Good morning, everyone. I'm really thrilled to be here this morning with these two women. They're both exceptionally gifted and have a passion for the subject that we're talking about today. Before I introduce Dr. Tracy Woodruff, I'd like to introduce my colleague, Dr. Deborah Anderson, who heads up the program with me that we do here in Los Angeles, Strong Yoga for Women. And Dr. Anderson is a specialist in neuroplasticity as well as a passionate advocate for environmental impact for fertility. So she's going to help us out with our Q&A today. I was really honored to meet Dr. Tracy Woodruff several years ago when I did a panel up in San Francisco. And I really was a novice. I was sitting on the panel because I happened to be the national spokesperson for the American Fertility Association, and I was blown away by she and her colleague, Dr. Linda Giudice's vast knowledge of the environmental impact on fertility and the far-reaching impact as it goes not only for women who are trying to conceive who are pregnant, but also for future generations. And she's going to give us an amazing kind of taste today of what that might mean for you at home and for here in the audience. Tracy Woodruff is a professor and director of the program on reproductive health and the environment at UCSF in San Francisco. Her research interests are to advance scientific inquiry, professional training, public education, and health policies that reduce the impacts of environmental contaminants on reproductive and developmental health. She studied at University of California, Berkeley, and got her master's in environmental health sciences. Also at University of California, Berkeley, she got her PhD in bioengineering, and in 1993, her postdoctoral fellowship on health policy. She's been honored several times. In 2002, she received the Science and Technology Achievement Award for the Environmental Protection Agency's first comprehensive national characterization of ambient air toxics concentrations. The Environmental Protection Agency's Gold Medal for exceptional service for outstanding contribution to the development and publication of U.S. EPA's American Children and the Environment, Measures of Contaminants, Body Burdens, and Illnesses. And finally, the EPA Silver Medal for outstanding contribution to the development and publication of U.S. EPA's supplemental guidance for assessing susceptibility from early life exposure to carcinogens. She's much smarter than I am. So I am going to hand it over to Dr. Tracy Woodruff to be your guide into environmental toxicity and reproductive health.
All right, thank you very much. So my story starts a little over 10 years ago when there was a patient who was actually seeing the other physician I work with, Dr. Linda Giudice. And she was seeing her because she had a chronic infertility problem. She was seeing her for multiple IVF treatments, which were not working. And this patient said to her, she said, do you think I can't get pregnant because I grew up near Love Canal? Love Canal is a Superfund site that's on the East Coast. It's a site that's contaminated with many different industrial chemicals, including PCBs, dioxins, and DDT. And the thing that was very interesting was that Dr. Giudice said, you know, I actually don't really know. And the thing is, I'm not really sure any physician really has a good understanding about the role of environmental chemicals and how they may be adversely impacting reproduction and development. So this has raised a concern. The other thing that was very interesting is that she noticed in her practice, as well as other physicians and healthcare professionals that we work with at UCSF and also in other institutions across the country and even around the world, is that there's a concern about the changes in the health of their practice, meaning that what we're seeing is an increase in women who are reporting that they have difficulty conceiving and maintaining their pregnancy. There's been reports of sperm decline in certain populations, not only in the United States, but in other areas of the world, declines in testosterone levels. And we also know that it's not just, doesn't stop at challenges with reproduction. We also have seen now, this is from the New York Times, maybe if you've read it last year, it's a report about male puberty. So this actually is the Leipzig Choir in Germany, Leipzig Choir, and they're very dependent on sopranos in order to have their boys' choir. But the problem is that because boys are entering puberty at younger and younger ages, this actually has had, even though we can kind of see it, it's actually had a very real effect on their ability to even have a choir that they have had for many, many hundreds of years. And actually, there's been documented recently over the last year declines, even though we know that female age of puberty has been going down. There is actually now a documented decline in the age of onset of male puberty among boys in the United States. And it just doesn't stop at fertility. It also is manifesting in what we're seeing in terms of increases in chronic health conditions among children in the United States. So right now, this is from data from the U.S. government, 1 in 6 children in the U.S. have reported neurodevelopmental disability. So we're seeing increases in reported attention deficit and hyperactivity disorder, autism, and this is on top of other types of chronic childhood diseases that have gone up, including obesity and asthma. So here's the thing. We can't see changes in the health conditions of the population over such a short period of time that's due to genetics. Evolution does not happen that fast. So there must be some other type of external factor that is influencing these types of changes we're seeing in our population. And while there are many different things that can be a benefit or detriment to your health, one thing that we know has been going up over the last 40 years, 50 to 40 years, is the amount of industrial chemicals that are produced and used in the United States. This is from some data that we have at UCSF that's from the federal government that looks at the increase in industrial chemical production in the United States. And you can see it's gone up well over 10-fold, up to 15-fold. So now in the U.S., there are many, literally thousands of industrial chemicals that are registered for use that can be used in the many different types of products that we come into contact with in our everyday lives. So whether it's chemicals in the air we breathe, in the food we eat, in the water we drink, or now we have a lot more information about chemicals that are in the products that we have in our everyday lives, things like our furniture or personal care products, things we put on our body, bring into our home, maybe are in the building materials that we use for our home. So industrial chemicals will have done some things that we can do many things. They also have, and because they're in their products, we become exposed to them. We can be exposed to them either in adulthood, during pregnancy, or throughout our lifetime. So what we know is because they're used in many different products, it makes sense that if they're used in many different places and we come into contact with them in many different situations, they can get into us. And so we have done studies, and there have been other studies that are done in the United States and other parts of the world that find that these chemicals can be measured in people. And we've published a study at UCSF looking at the actual industrial chemicals that are measured in women and pregnant women across the United States. And it's not just 1, 2, 3, but it's literally dozens of different chemicals that are found in pregnant women or men or children across the United States. And so we're carrying a baseline or a load of industrial chemicals already in our bodies. So let me just talk about an example of one of them. It's phthalates. You may be familiar with this because you can actually go to the store now and there'll be things that are labeled phthalate-free. Phthalates are a particular chemical. They're manufactured in what we call high volume. That means more than millions of pounds per year. They're a plasticizer, so they're used to make hard plastic soft. So they're in vinyl type of products, maybe vinyl flooring, vinyl plastic tubes that you might have in the hospital. They're also used in personal care products, so they can be used to essentially convey a scent. The other thing is, so they're used in all these different products. We also find them in people. So there are some phthalates that we find in 98 to 100% of people in the United States, including pregnant women. So what is the thing about phthalates that brings a concern? Well, phthalates, some of the phthalates have this unique property, or not unique, but they have this property that they have this ability to interfere with testosterone. So testosterone, that's the male hormone, very important for male reproduction. Also, it's very critical, not just for maintaining male homeostasis, but also male reproduction, but it's really important during development. So during pregnancy, there's a surge of testosterone level that is really critical in order to have proper male reproductive development. So testosterone goes up. That signals the time that all the male reproductive parts are developed and formed. So if you don't get enough testosterone, then you can not quite get the full, complete male reproductive development. And we know that phthalates have an effect of causing declines in testosterone levels during pregnancy. This has been shown in animals in several different studies. And so what you basically can get, and now we have some human studies that suggest you can get this feminization of men from these exposures to phthalates that can occur during the developmental period. And now there's actually, this study just came out last year, was discussed in the New York Times, looking at, okay, so you can affect the development of males in utero. You can observe it after birth. What about when they grow up? And now we have some studies that suggest, there have been studies looking at phthalates and finding a link between adult exposure to phthalates and effects on sperm quality. But now we also have a study showing that there's a link between exposure to phthalates and the length of time it takes for couples to get pregnant, meaning higher exposure to phthalates is associated with taking a longer time for a couple to get pregnant in men. Okay, so we really want to spend some time also talking about some of these issues. So I just want to talk briefly about phthalates is just one of the chemicals that we measure in people, along with BPA, flame retardants that are used in polyurethane foam, PCBs, perfluorinated chemicals. So each one of these comes from different places and has different types of health effects. I would suffice to say that there has been numbers of different professional societies who've looked at the broad range of literature to understand what do we know about the links between exposures to environmental chemicals and how they may adversely impact reproduction and development. And the Endocrine Society, the American Congress of Obstetricians and Gynecologists, the American Society of Reproductive Medicine have all said that the science is robust in terms of linking environmental exposures to adverse outcomes in reproduction and development, and that really it's time that we take the science we have at hand and take actions in order to reduce these harmful chemical exposures. So here's something that's happened over the last, I would say 5 to 6 years, but about 10 years, is that, so phthalates, I've talked a little bit about phthalates, talked about how they may adversely impact male reproductive development. Exposures that occur during pregnancy are particularly important because that's a really critical period of development that can lead to problems later in life. So what happened was, people got concerned about this. They said, I don't actually really, I'm concerned about that there's these exposures can adversely impact my baby. So the environmental groups found that some of these phthalates, as I said earlier, are used in personal care products. They said, do we really need to have phthalates in personal care products? So they started a campaign, and this is from the campaign saying, asking manufacturers of personal care products to take phthalates out of the personal care products. They also, because of the science and because of the concern about phthalates in not only personal care products, but also in products that children might come into contact with, including toys, because they're used in vinyl toys, said, it's one thing to change what's going on in the marketplace, but we also need to take it out of the product stream so that even if we go to the store and we can't quite read the labels or figure out what it is, that when we go to buy a product, we know it doesn't have phthalates because that can be harmful for my child or my developing baby. And so there was actually a ban passed in 2008 for several different phthalates in Washington, D.C. that was signed by President Bush. So, so what we see is, okay, because sometimes when I go and talk about environmental chemicals and I'm just spending a brief snapshot of time on this, is people get a little bit depressed because they're like, oh, there's a lot of chemicals out there. There are all these things I come into contact with, and they might harm me or my family. And I'm talking about phthalates because there's also good news in our ability to do something about these exposures once they occur. So in the case of the phthalates, okay, we found people were exposed to phthalates. We knew they could adversely impact reproduction and development. We took action at the marketplace and at the federal level, and here actually is something that we just published this year that shows it actually mattered. So The study on the left is from the Campaign for Safer Cosmetics. They actually had done went out, they bought personal care products, they measured them to see what phthalates were in there. From the original campaign, they said, yes, a lot of these personal care products like perfume and underarm deodorant and shampoos had all these different phthalates. They looked at it a few years later, and many of them have been taken out of these products. And what we see now, this is from a study we just published last year in Environmental Health Perspectives, that there is a decline in one of the main phthalates that's used in personal care products, monoethyl phthalate, of about 40% in the U.S. population, which we attribute to partly this market-based campaign for taking phthalates out of products. So something in the marketplace actually had an effect in terms of our exposures to phthalates. The other thing we see is that 2001, that's the pink on the left, is the amount of phthalates measured, two different phthalates that were then banned in 2008. And then that's the level down there in 2010. They went down anywhere between 15 to 40%. These are the phthalates that were banned in the toys. Now, you're thinking, well, it's just in toys. How can you measure in adults? Adults don't really use toys. But I think, what happens is manufacturers see this ban, and then while they're replacing it in one product, it likely can come out of others. But this is also a really good news story. It means that if we identify a problem, we have the ability to take action that makes a difference. Now, the challenge is that we did take out the DBP, DEHP, and DEP have gone down in the U.S. population. Unfortunately, there's several phthalates that have gone up. So while we think that there's chemicals coming out of the manufacturing stream, other ones are going in. So this is while it's good that we can focus on some, we still have a challenge because our approaches to dealing with these chemicals, not just phthalates, but many other industrial chemicals, is piecemeal. And so we can end up having this kind of whack-a-mole phenomenon where you focus on one, but then other ones come into the marketplace. So I just wanted to mention that one of the things that we get that is of concern to people is what's their ability to prevent their own personal exposures to industrial chemicals. We've put together these brochures that consolidate evidence-based recommendations based on scientific studies and other types of information that show that there are certain things you can do in your personal life to reduce chemical exposures. Some of them include phthalates and changes you can make either in your diet or the kinds of products you buy or bring into your home. And the brochures are available online as well as we have copies here. Now, like I said, there are things you can do, and they have been shown scientifically, to reduce your exposures to certain chemicals, but you can't do everything. And that's because, for one, we don't know where all the chemicals are because there's no requirement in the United States to know where all the chemicals are used in which products that we may buy or bring into our houses. And then also some of these chemicals, it's not really possible for us to control them. So, for example, if they're a chemical that's an air pollutant, you and I do not really have personal control over air pollution or water pollution or even things sometimes in our food. So this is from a study that was done at up in Washington State. This is Molly Gray. She was, that's her baby. She was, at the time, trying to get pregnant, and she was eating organic. She avoided BPA. She bought natural cleaners. She did the kinds of things that we recommend you do in our brochures and Toxic Matters. But she still had measurable levels of chemicals that have been associated with adverse reproductive or developmental outcomes, including bisphenol A, mercury, phthalates, and perfluorinated compounds. Because the challenge is that while you can do things and you can lower your levels, there are some things that you can't do that are beyond your control. And that's why we need to have both a combination of these marketplace activities as well as a focus on public policy so that we can reduce the exposures from the source at the upstream without putting the burden on us, healthcare providers, or patients. So this is a quote from Dr. Jeannie Connery, who's the president of ACOG. ACOG is the American Congress of Obstetricians and Gynecologists. So this is a professional society that represents physicians who are dedicated to improving women's health, and they represent obstetricians who see pregnant patients and gynecologists who see general women's practice. And they came out with a committee opinion last year, as I mentioned, saying that they're concerned about the role of industrial chemicals and how that may be adversely impacting reproductive health in the environment. But what's really key about their message is, one is they say the science is robust. Two, you can take personal actions to reduce your exposures, but also that we have to shift the burden of proof from individual healthcare providers and customers to the manufacturers so that when you go to the store or when you buy a product, we know it's safe before it comes onto the marketplace. And so with that, I want to leave time for us to have a discussion, because I know that there's many questions that people have after we talk about environmental chemicals and reproductive environmental health. Just would say that there's many exposures. The exposures can have implications, adverse implications for reproduction and development, but there are things that we can do to reduce these exposures. And the Program on Reproductive Health and the Environment at UCSF is dedicated to understanding better the science. We do science about exposures to industrial chemicals and how they may adversely impact pregnancy, and then we work to translate that science to better affect change so that we can reduce harmful chemical exposures. Thank you.
Thank you, Tracy. One of the things that I became aware of, as I'm sure you are at home and in the audience, is it can seem overwhelming when you find out that there's all of these things present in our environment, in our food, in our water, in our air, in our toys, in our cosmetics. And my head started spinning. And actually, it's one of the things that I started to teach. I started to use UCSF's materials in my yoga classes to help to educate women about what they can do to protect their bodies and to lower their impact from these chemicals in their lives. And there's a wonderful group out there called the Environmental Working Group that you can go online and you can look. There's a product list that they have that Tracy mentioned that's called Safe Cosmetics. And you can actually put in your own personal care products in there, and they will show you on a scale of 1 to 10 basically where that is in the toxicity of the environmental endocrine disruptor that it might be for you, for fertility specifically. I wanted to have Deborah talk about this because she was in my class when I taught this first, and I think she may be able to share a story that will help you to understand what the process is once you find this information. So, Deborah.
So when I took this, it was very interesting to me, both for my personal health, but I'm also a health psychologist. So I work with patients, and then I'm a yoga teacher for Strong Yoga for Fertility. And I'm the type of person, I tell people the story that when I hear and learn about things, I just sort of go for it. So I basically went home from class and looked at all my stuff and threw it out and started replacing everything. But what I tell my patients and my students is that if that's too overwhelming for you, it's okay. Finish your toothpaste and then find a safer one, and then finish your bottle of shampoo and find a safer one. So, you know, it's like anything. What I always share with people is you can only control yourself, and there are certain things you can't control. So make the changes that you can that are within your control, and let go of the things that you can't. So as Tracy talked about, you know, we may not be able to change the air pollution as one person, but certainly we can become advocates for certain things. But to feel that sense of control, just start doing things every day, little by little, to improve your life and the environment that you're in.
Do we have any questions from our audience here?
And I just wanted to add to something that you said, Tracy, was, you know, the whole whack-a-mole thing. So the whole BPA, most people are familiar now with BPA, bisphenol A, and how now they make BPA-free bottles, and a lot of baby products, in particular, you know, sippy cups and their toys are all BPA-free. But what happened was there's some research now that shows they replaced BPA with BPS, bisphenol S. And now they're finding that that's just as much of an endocrine disruptor as BPA is. So again, you know, go to things that we just know are safer. Buy glass, use wood, use stainless steel, things that are, you know, not as manufactured, so to speak, products.
And just to add to that, something as basic as not drinking out of plastic bottles anymore, or not leaving them in your car and allowing them to heat, or freezing them, because this actually draws the chemicals into the water, and then you are drinking it and consuming it. So just understanding that, you can make small changes by drinking out of glass instead, or containers that won't be contaminants for the actual products that you're consuming. And also not putting them in the microwave. I'm sure most of you by now have heard that, but I just always have to say it in case there's someone at home: do not put plastic in the microwave and cook your food in it. So that's just a basic thing to understand.
Okay, so I want to see if there's any questions in the audience. Would anyone like to ask a question? Yes, please.
Hi, thank you for all that. I just wanted to know, so since we are all exposed and our body does have mechanisms of detoxification, what are your suggestions in terms of, decreasing body burden and all that? And because I know that different toxicants have, some are metabolized quickly and some are not. So what is your suggestion in terms of how to, pass it through?
So, right. So we have different chemicals. So your point is very well taken. Some of the chemicals, if you were exposed to it once, like BPA and phthalates, and you weren't exposed to it again, it would be gone from your body and within 24 hours. They just come in, they get in, they go out. But because people are exposed to them all the time, it looks like they are measured all the time because there's many different sources. So the best way for those chemicals is really to avoid the source of the exposure, because then you can decrease it. And even something like mercury, which is that can hang around in your body for a little while. But there have been people who've done this, or studies shown that if you avoid the main source of mercury, which is very big fish for it mostly, you can actually reduce your levels of mercury within 3 months. So some of them take a little bit of time to go down. And then some of these other chemicals, they kind of hang around, right? They're like bad house guests or something. They have this property that makes them get out in the environment. They just sit around and they get into the food chain. But those you can also, you switch up your diet. So they love fats. So they hang out in fatty food. So try and not eat a lot of fatty food. And then what we've actually shown with so one of those chemicals is polybrominated diphenyl ethers. They're basically have been used in foam, but they were phased out in California. Some of them will actually go down, not maybe in 3 months, but within a year or so. We've seen a decline in the California population even over the last 5 years because there's been a ban in California on them. So I don't know of any effective detoxification program, and I would be a little wary of it because I'm not sure they're all very safe. So, it's better to avoid than to try and do something else.
I'd like to add something onto that, because that's actually, I think, where yoga can be extremely helpful. Consider your body as a sponge. It's porous. And so when you drink things, eat things, breathe things, it goes into your body. And like a kitchen sponge, if you don't rinse it out and twist it and remove the dirt or the soil, pretty soon if you leave your kitchen sponge without cleaning it, it starts to smell, right? Well, your body's the same way. If you don't exercise it, if you don't sweat, if you don't breathe deeply and move the toxins out of your lungs or twist your organs, those toxins stay dormant and more sedentary in the body. But if you can move the body, flush it with water, breathe deeply, these are the body's natural ways of detoxifying. And so that, in addition to taking small breaks from your normal patterns and maybe doing a juice cleanse or doing something that gives your body an opportunity to detoxify. And I know Dr. Daoxing Ni, who will be here later today, also has an infrared sauna in his facility. An infrared sauna is wonderful for lymphatic drainage, as is yoga. So these are small tools that you can do that are healthy, that will start to minimize kind of that sedentary toxicity in the body.
Thank you. I think we have a question over here.
A comment. I'm Don Evenson. I'm a reproductive toxicologist, and so I'll talk a little bit about the male side. Some years ago, we worked in Teplice, Czech Republic, where they had a huge problem with regard to wintertime inversion due to the coal burning plants there. So I worked with the EPA and the Czech government, and my role was looking at the men's sperm, and we found that the level of DNA damage in the sperm was pathologically high, just in the Czech recruits of the age like 20-some years of age. So an example of pollution causing major problems for reproductive health. I think, like, for example, the smog here in Los Angeles. Like, I think about 10% of your smog comes from China. And you look at the smog over in like Beijing and so forth. I mean, it's tremendous. And so there's like recommendations we've seen, like if, for example, it's a smoggy day, don't run and breathe deep, Brenda, because stay inside that day, I guess. But there's an example for men's reproductive health and smog.
Terrific, thank you.
Yeah, and Tracy, maybe you can add to this as well, but just so people are aware, you talked about testosterone and the male factor, but in women, my understanding is the pathway is testosterone breaks down into progesterone and then into estrogen. So when it impacts testosterone, it's actually impacting our female hormones as well that are so, crucial for reproduction. So it's not just the testosterone factor that we have to be worried about. These endocrine disruptors are impacting women's hormones as well.
Yeah, and I think I know that study sure, that's a great study. Okay. Air pollution is bad, so there's lots of studies showing that air pollution is not a cardiovascular and also a lung problem, but we've also been looking at it as a reproductive health problem. I know you've done the studies on the male sperm, but we've also seen that exposures during pregnancy can increase the risk of preterm birth and low birth weight. So it's definitely, there's actually some studies that people have done in Europe looking to see the efficacy of putting in filters in their house for reducing particulate matter, and it actually seems to work reasonably well. So I haven't been suspicious of that, but there are some kind of filter mechanisms that people can use to reduce some of the particulate matter in their house.
I had one from Brookstone. So for those of you, it helps to purify the air. So if you do have a little bit more exposure, if you're living in a city, that might not be a bad idea. One of the other things that you talked about beautifully was kind of shopping. And that your dollar does make a difference in the impact in the manufacturing of things, because they'll start to notice, our productivity is going down because people aren't buying this product anymore. And one of the things that I became aware of, I think it was from your earlier studies, that there was an entire workforce of migrant workers in South America who were working with bananas. And there was a certain pesticide used in the production of those bananas because they were non-organic bananas. And an entire male population of those workers became sterile. And so when we talk about voting with your dollar, you're not only voting for your own body to put more organic, less pesticide, infused food into your body, but you're also voting for the planet, because there are migrant workers and people who are preparing those foods that are impacted by those choices that you make. So when you buy things that are less pesticide-free, you're actually helping the people that are bringing you that food as well. So it's kind of a bigger global view of how can I make a choice that not only is healthy for me, but healthy for others.
Awesome. So do we have any questions in the back?
You led in perfectly to my question, and that is, a lot of these products that are chemical free and very safe and organic or whatever are premium products. And so when you're talking with folks who have economic constraints, are there some key guidelines or some key recommendations that you can say to them, here are some cheaper, safe ways to get safe, because they can't buy the organic toothpaste and deodorant and shampoo and product, so I'd love to hear.
Yeah, absolutely. There are things you can do. The Environmental Working Group has an app called the Clean 15 and the Dirty Dozen. And so it talks about which foods are less likely. The Clean 15 are the ones that, even if they're exposed to pesticides, are less likely to take them in. So if you need to buy the non-organic versions, those ones are a little bit safer. The other thing is, it's going old school, is that we can make a lot of our beauty body products ourselves, or our cleaning products for our home ourselves, with good old basic things like vinegar and baking soda, or using coconut oil as a moisturizer for your skin. We don't actually have to buy everything, in nice, pretty packages, so to speak.
Yeah, that's a great point about the cleaning products, because it's actually cheaper to make your own cleaning products than to buy the ones in the stores. So, and they can work just as effectively. And also, there's other things that don't cost any money. Take your shoes off when you go in the house. Keeping dust down, because a lot of chemicals get into the dust, and that's how people get exposed to it. Even washing, there's been studies showing that washing your hands before meals or more often during the day actually reduces your exposure to some of these chemicals. So there's actually things that people can do that actually are effective, that don't cost a lot or much money.
I think there's also a kind of a groundswell movement of having smaller farms in communities. I know in Seattle, they're now taking a public park and they're making a community vegetable garden, so that everyone, regardless of socioeconomic status, has access to fresh vegetables. And it becomes much more of a collective community effort as well. And it's educating people about their food. I know a lot of people assume that they have to get food from the grocery store. They didn't have the privilege of growing up on a farm like I did. My grandparents were farmers. So inner city kids, we as the parents to these children coming forth, we can educate them about food sources and how it impacts their health and well-being. And it doesn't have to be expensive. It can be something like cooking at home instead of going and buying a frozen food, and doing the ingredients with these less impacted pesticide-free foods. So. It is a challenge. It takes a little bit more time, but I think the educational base out there is starting to really wake up, and our children are calling for it.
Thank you. These are wonderful answers. We just have, actually, from our social media manager, Holly, a question that came in from one of our social media outlets. Uterine fibroids are an issue for a lot of women, and I'm wondering if you've had any experience. I know a lot of people are saying that they don't understand what's causing them, essentially, and it is a hormonal imbalance, potentially a liver situation. But have you noticed that the question was about environmental impact on uterine fibroids?
Yeah, that's actually a really great question, because uterine fibroids can affect a pretty high percentage of women. I think it's over 50%, and it's higher for African American women than it is for Caucasian women. I think it's like one study has upward of like 70% of African American women will have uterine leiomyomas during her lifetime. The challenge with these, not just for environmental chemicals, but also just general medical care, is it's not well studied. They're hard to study, and the healthcare system doesn't necessarily think of them as important, because they're not always cancerous. They're called benign, and I put that around quotes because somebody who has them, it's not benign to them. So I just think, just generally for women's health issues, that this is an area that we need more focus in, because it's been a neglected research area. There is some studies suggesting that so if it's neglected just generally in terms of research, it's even more neglected on the environmental side. But there are some studies that suggest there are some chemicals that can be associated with increasing incidence of these uterine fibroids, some of these more persistent chemicals. And there is some studies that suggest that that developmental exposures during the time when the uterine tract is being laid down might interrupt that development, particularly if they're estrogenic chemicals, for example, BPA. There's some studies in animals suggesting that might increase the risk of some of these uterine fibroids in adulthood. And there's actually some studies on genistein. So it's in baby formula. And the National Toxicology Program did some work on this. So one thing I would recommend is to avoid sort of soy-based products for your baby if you're looking at formula alternatives, if you're not breastfeeding.
And I don't know what the status is now, but a couple of years ago, I have a 3-year-old granddaughter from my stepdaughter who's an adult. And when we were looking for formulas, because my stepdaughter couldn't breastfeed very easily, there was not one formula on the market that didn't have soy. it either had soy protein or it had soy oil of some sort in it. So I don't even know if that exists right now because I haven't looked, because we actually, from a holistic healthcare provider, he gave us a formula, and we homemade baby formula for her out of natural products. So,
is there any relationship to increase of fibroids with diet or glucose balance or anything like that? Is there any kind of connection to nutritional choices that might lessen the fibroids?
I mean, that makes sense, but I'm not familiar with that science. So,
I just want to thank you all so much for such wonderful information and wonderful answers to the questions. And thank you all for being here and a part of this. Would you like to say any closing words? We do need to wrap up, but if you want to say anything else.
I just want to say thank you to Dr. Woodruff and the program that she's with, and the passion that they lead this information, not only to us as the consumer, but to the legislators who have an impact on the exposure that we have on a daily basis. So I see you as a pioneer and an incredible leader of this very necessary voice in our community. So thank you.
well, thank you. You've also been an amazing leader on this, and you have made this happen, and I really appreciate it.